I am Dr. Sami, a physician over here in Jalna, and I have been practicing since 1999 in my own setup, that is Care Hospital, which is located in Old Jalna. So, since the topic of blood pressure and hypertension is a quite burning one, and day by day the incidence is rising many folds. So it is very important to understand what is hypertension. So in view of this, I'm here to discuss few issues regarding what is hypertension and what is the gravity of the situation and what could be done for that. So generally, everyone would like to have healthy or normal blood pressure, but what exactly does it mean? Basically, each time when the heart beats, it pumps blood into the blood vessels, that is our circulation. This creates pressure against the walls of the blood vessels, and that pressure which is exerted over the walls of the blood vessels is called as blood pressure. And when this blood pressure rises above a particular level, that is by large, it is if it is above 130 by 80 millimeters of mercury, then that blood pressure is called as hypertension. And this hypertension is a disease which can lead to serious to life-threatening complications in future. High blood pressure usually develops over a period of time, so that is why it is called a silent killer also, because most of the times the patient do not have any complaints as regards hypertension or high blood pressure. It is only when the BP rises quite high, and if it remains high for a long time, the individual develops certain symptoms. So it can happen because of unhealthy lifestyle choices. For example, for having not having enough physical activity, or having an obesity, and some abnormal habits like smoking, alcohol consumption, and stress, of course. There are other risk factors that can also increase the risk of developing hypertension, such as age. That is, as people get older, the arteries get stiff, and this stiffness can lead to high blood pressure. Family history of high blood pressure is also one of the cause. Excess salt intake, not eating enough foods with potassium can increase the chances of high blood pressure. Eating processed and fatty foods, which is a very common fashion nowadays, are causes fats to increase throughout the body, and which again leads to stiffening of the vessels, secondary to certain metabolic changes, and which can again lead to high blood pressure. Another one, which is stress, reacting to stress in an unhealthy way, is also a very important cause of high blood pressure. Moving on, hypertension does not have any obvious signs and symptoms. As I told you earlier, that is why it is called as a silent killer. It puts people at risk for several diseases, from cardiovascular problems to kidney failure, stroke, and even eye damage and blindness. Hence, an early and accurate diagnosis is very important in management of hypertension. Measuring the blood pressure is the only way to know whether a person has high blood pressure or not. Generally, when symptoms do occur, they include morning headaches or tiredness, vision changes, buzzing in the ears, fatigue, and nausea, sometimes vomiting. If person is experiencing some of these symptoms, then one should get their blood pressure checked immediately. Fortunately, high blood pressure can be easily diagnosed. It is usually measured with an instrument called a sphygmomanometer. Blood pressure is recorded in two numbers, systolic and diastolic. Now let's try and understand what do these numbers actually mean. A healthy or normal blood pressure should be lower than 120 over 80 millimeter mercury, or it can also be read as 120 by 80 millimeters mercury. Here the upper number indicates systolic blood pressure and the lower one indicates the diastolic blood pressure. The systolic blood pressure means that is the pressure exerted by the heart when the myocardium contracts. And the diastolic pressure is the pressure over the blood vessels when the heart relaxes. So if the blood pressure is like 140 over 90 millimeter mercury, then the person has a hypertension. If persons have below BP levels higher than this, he or she might have a risk of developing serious heart disease. So recently on May 17th, we celebrated World Hypertension Day, a day dedicated to highlighting the importance of monitoring the blood pressure and bringing global awareness to the 1 billion people living with high blood pressure worldwide. The theme of the year's World Hypertension Day is measure your blood pressure, control it, live longer. So very nice theme, like measure your blood pressure, control it, and live longer. Ensure that your BP is measured and controlled if it is elevated. Now, we'll discuss a few risks that can be prevented and which can be very important in reducing the blood pressure. So, the first one being the individual should undertake a regular exercise. He should have a healthy diet. He should quit smoking and alcohol intake. He should be regularly monitoring his blood pressure. Stress management is a very important thing, and adherence to the medicine is the most important thing. If blood pressure is successfully controlled with such lifestyle modifications, then it might avoid, delay, or reduce the need for medication. So let's take a look at these strategies one by one. Now, regular exercise and physical activity. Exercise can be a drug-free approach to lower high blood pressure. A regular physical activity makes person's heart stronger. If one have a strong and healthy heart, it can pump blood into the circulation with more ease. And the exercise part, as we all know, it decreases the vascular tone. So by decreasing the vascular tone, automatically the blood pressure comes down. That is a very important aspect of lowering the blood pressure non-pharmacologically, that is by exercise. So regular exercise also helps to maintain healthy weight, which in my opinion is an important way to control blood pressure. One should aim at least 30 minutes of aerobic activity most of the days of the week. High BP level can be reduced by doing regular structured exercise such as brisk walking, jogging, or swimming. The second important point is the healthy diet. Diet also has an important role in controlling blood pressure. We can adopt of the following diets which are suitable to an individual. There is a DASH diet or a Mediterranean diet, eating less saturated fat and a total fat, getting plenty of potassium, and limiting the amount of sodium in the diet and avoiding alcohol consumption. DASH stands for dietary approaches to stop hypertension. Eating a DASH diet that is rich in whole grains, fruits, vegetables, and low-fat dairy products, and skims on saturated fat and cholesterol can lower one's blood pressure by up to 11 millimeter mercury, and which is a considerable decrease in the blood pressure. Then reducing the sodium in your diet. Even a small reduction of the sodium in the diet can improve the heart health and reduce blood pressure by about 5 to 6 millimeters of mercury. If you have a high blood pressure, to decrease sodium in your diet, you can consider tips like the following. You should read food labels. That is very important. If possible, choose low sodium alternatives of the foods and beverages you normally buy. Eat fewer processed foods. Only a small amount of sodium occurs naturally in the foods. Most sodium is added during processing, so you can eat natural products. Don't add salt. Just 1 level teaspoon of salt has 2,300 milligrams of sodium. Avoid adding salt to the food is very important, and use herbs or spices to add flavor to your food. So that's a very important, I mean to say, alternative to salt. That is, you can add some spices or some herbs for taste, because salt is basically consumed for taste. Now, another important point is quit smoking. Smoking is very dangerous, not only for the cardiac part, but also it is got deleterious effect over the brain, or the lungs, or the kidneys, or the you can say limbs. And the common mechanism for all these organs to be affected is that smoking basically attacks over the blood vessels, making them stiff. Now we'll come to regular blood pressure monitoring. Some of the hypertensive patients check their blood pressure by visiting doctors, but it is not always possible for patients to visit doctors and check up their blood pressure. Hence, most of them are often advised to undergo self-monitoring of blood pressure. Like SMBG, self-monitoring of the blood glucose levels, is a concept since quite long, since quite some time. So also the concept of blood pressure is also very important. And in my view, I have seen certain patients who have a blood pressure normal at their homes, or when they monitor their blood pressure at their own places. And these, I'm speaking of hypertensive individuals. And when they come to the hospital because of the concept called as the white coat hypertension, a few of the patients do have a high blood pressure, and that remains so as long as the patient remains in the OPD, in the clinic. So this part is also very important, because when the patient comes to us with a high blood pressure in the OPD clinic, naturally we would like to increase the dose of the antihypertensive, and thereby increasing the burden of the drug over the patient. And this can be very well decreased, or can be taken care of by asking the patient to take blood pressure at home and keep a record and bring that record. And so very interesting that when we see the record, we find that at home, the blood pressure was most of the times normal. Stress management, by learning how to relax and manage stress, can improve emotional and physical health and lowers high blood pressure. Stress management techniques, including exercise, listening to music, focusing on something calm or peaceful, and meditating, are the important ways of stress management. And lastly, but not the least, is adherence to the medicine. A medicine to lower blood pressure may be recommended by the doctor. If your blood pressure is consistently high, usually at or above 140 by 90 millimeters of mercury, adherence to medicine is very important, as it controls your blood pressure regularly. At last, I would like to suggest that there is nothing more precious than having fit and healthy life. Adopting healthy lifestyle can help us to enjoy a long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in the normal range is very important in preventing cardiovascular complications. It is very much possible to maintain normal blood pressure levels with regular monitoring and preventive care. Thank you for your patient listening.